So this recording will go over your assignments that you're going to be doing in lieu of meeting in person on Tuesday, January 21st, since classes were canceled due to the cold weather. So I'm just going to walk you through the assignments to make sure you understand what the complete assignment is, and then if you have any questions, you can reach out to me. All right, first on the list is to watch this class greeting, which we're doing right now. Second then assignment is to complete two Kahoots, 2A and 2B. So Kahoots, if you've never played Kahoots before, they're like an online quizzy type activity. It's meant to be fun, nothing too serious. You could bomb it and it's not going to affect your grade at all. You just have to complete it. So make sure you use your name when you complete it so I can mark off that you did the activity. You only have to do the Kahoot once. That being said, you are allowed to do it more than once. So if you do it once and you got a 50% because you're rusty on your potassium, calcium, you can review it and go back and do the Kahoot again. So you can do it as many times as you want. You're required to do it once. Okay, so you got your two Kahoots, acid base as well as the electrolyte one. The next assignment then is a Nearpod related to ABG lab interpretation. The big disclaimer here is this was created for the 10th edition textbook, and since I had limited time to put assignments together for you guys, I just left it how it currently is. The 10th edition textbook used a different normal lab value for bicarbonate. They used 21 to 28. We are going to continue using what we have in our 11th edition textbook. So bicarb normal value is 23 to 30. But in the Nearpod, it's going to have that old number that they used in the 10th edition. So everything else is the same, except instead of bicarb being 21 to 28, we're sticking with our normal value of 23 to 30. And to join the Nearpod, you guys all did the other one, so you should be good there. You got your code for accessing the Nearpod. This ABG lab interpretation, total of 3 slides, takes approximately 20 minutes. And the last slide asks you how you feel about the tic-tac-toe method for analyzing ABG lab values. The next activity is another Nearpod activity related to cardiac conduction, ECG, and normal sinus rhythm. You'll first want to read in the textbook and get familiar with those topics, and then complete the Nearpod. Got your code here to access the Nearpod. It's a total of 9 slides, approximately 40 minutes. Obviously, it's going to take longer if you stop and take notes and all that. If you start the Nearpod and then have to stop for whatever reason, complete it the next day, you should be able to complete it as long as you're using the same device. The final Nearpod slide for the cardiac one just asks you if you enjoyed the cardiac Nearpod. You got some recorded lectures. So we have one for lupus. I ask that you review the safe sex practices that are bulleted on the bottom left of page 1586 in your textbook, and then watch a recording over herpes. Review the conflict resolution tool that's found on Module 2. This is basically a 3-step tool that helps you initiate conversation when you're experiencing conflict or disagreement, anything like that in the workplace. So you can find the tool, the 3-part tool, under Module 2. You have a little video, just over 2-minute video that shows an example of the CUS tool being used in action. And then you have a 2-part discussion board related to conflict and difficult discussions. So part 1's due by Friday, this Friday before midnight. Basically, you're going to talk about an example from clinical work, wherever, that's describing conflict or a mistake related to patient care. The clinical event should be something that would require the nurse to speak up on behalf of patient safety, ethics, or legal obligations. Then part 2 is due by Monday, when the whole ticket to class is due, right? We want to make sure all our assignments are due by Monday by 8 a.m., 7:59 a.m. here. So you do a peer response. So student A will list, here's this conflict that I had going on at work. And student B, as part of the peer response, would use that CUS tool to describe how they would initiate or how they would handle conversation related to that conflict. So again, the video is going to give you an example of a provider using that CUS tool when talking about some sort of conflict or difficult discussion. And you guys will be giving examples of that on the discussion board. Peer response should be a minimum of 3 sentences, which is what the CUS tool will give you, but it can be longer if you want to elaborate. You'll also be watching the Transgender Healthcare Horror Stories video that's located under the Canvas Ticket to Class module. And finally, one medication that you're going to be reviewing, diphenhydramine. So look up diphenhydramine, look at the classification, how is it working, side effects, all that good stuff, and then pick out your top 5 nursing considerations for the medication diphenhydramine. I intentionally did not put anything related to HIV or AIDS in this ticket to class assignment, asynchronous online assignment. We're going to talk about that in class when we meet next week because I'm going to simplify some of the things from the HIV AIDS chapter. So it's a little bit more in depth than I'm going to require you guys to memorize, and we'll just wait and do that in person. So if you have any questions about our online asynchronous assignment, again, you can do it anytime you want to. The big thing is you got the initial discussion board due by Friday. Everything else has to be completed by Monday, 7:59 a.m. So you want to make sure it's a lot, right? Don't like save it all for one night. Maybe try to plug through it a little bit daily, however you want to do it over 2 days. But again, it's not just completing the assignment, but also studying the content. So you want to be reviewing your acid-base balances, reviewing your different type of allergies, the things we went over on the first day of class, studying lupus, right? Not just watching the video and saying, check it off the to-do list, I did it, but study it and become comfortable with that material. Let me see. Okay, the reason I say study and become comfortable with it is because here we are in week 2, right? Next week we'll meet face to face again. We'll wrap up HIV, AIDS, Lyme disease, transplant, rejection, and we'll do the beginning part of the cancer chapter. So we'll look at pathophysiology, cancer development, health promotion, cancer prevention. So just the first part of that cancer chapter. And then on week 4, February 4th, you'll have your first exam. So the goal is that we stay on track with content. First exam for sure is going to be on the 4th. Is it possible, like if we don't get to transplant rejection, I would just save it. We wouldn't test over it. So we're going to include on your first exam whatever content we're able to get through and wrap up next week. And of course, we'll also be talking about your ticket to class activities, the meds we've talked about, doing a couple ABG lab values examples, making sure you feel good with that. We'll talk about normal sinus rhythm, right? We will spend time reinforcing all the content that we talked about. All right, that's all I really have for now. Don't hesitate to reach out if you have any questions at all, if you have any technical issues, anything like that while trying to get this assignment done. Stay warm, and I will see you guys next week.